So my name's Emily. I am the clinical director at the Barn Animal Hospital. We are a small animal hospital, tier 3 hospital located in Basingstoke. We currently have 6.5 vets and 14 registered nurses and a kennel assistant. The practice has been open for 20 years. We are currently looking to expand because we are becoming limited for space with the growth of the business. So at the barn we do offer a large number of appointments, approximately 120 a day. We currently operate on a 10-minute consulting time due to space limitations. Approximately 40% of our consultations are cats. If we need longer appointments, we are more than happy to book those in. So for blood pressure, 20 minutes, more complicated cases will have 20 minutes. We offer nurse clinics twice a week, and they tend to see older animals, blood pressure checks, second vaccines, worming and flea treatment. So we do try to push blood pressure a lot with our feline clients. Generally we would try to suggest that everything has a blood pressure check once a year. However, often there is a little bit of difficulty with clients believing that a healthy cat should have its blood pressure checked when it's under 8. We suggest from 7 that they definitely have them once a year, and over 11 or 12 twice a year. We do 3 monthly blood pressure checks on any animal that has chronic kidney disease, hypothyroidism, diabetes, or any evidence of any target organ damage, and they are either done by a vet in a 20-minute appointment or by a nurse in a nurse clinic. We generally tend to use a Doppler. We have multiple available throughout the practice, both for anaesthetised animals and for consultations or nurse clinics. We find this the most accurate and easily reproducible method of attaining a blood pressure reading. We do have a practice protocol that has been created actually using the ISFM guidelines. So we generally like to ensure that we have an appropriate amount of time for a cat to come in and relax. It's very important to acclimatise. All nurses and vets are aware that we are to use appropriately sized cuffs, to use a forelimb, to always note which leg you've taken it from, the temperament of the animal, etc. But we do find with cats it is very temperament orientated. How are you going to get your reading? Are you able to do it in a consultation? Is it better in the cattery? Is it better with the client? So we try to reduce stress from the moment that the cat comes into the practice. We have a separate dog and a cat waiting room. We have Feliway blankets available in the waiting room and shelving for cats to have their baskets placed into, so they're not irritated by dogs. If cats are particularly stressed by coming to the vets, we will often ask the client to take them straight out to the prep room so that we can put them in the cattery to allow them to acclimatise or relax, or alternatively to wait in the car until we have the appointment time available for them. All cats are provided with the time to acclimatise, so generally we like them to come in with their own bedding. We use Feliway also within our consultation rooms with plugins, and we have Feliway spray. It depends really as to the client, as to whether the client stays in the room or not. Some clients that can be potentially over anxious or distracted with phones, etc. work, we'll often say you can have a seat and then we will look after the cat. We always ensure that we've got a very empathetic member of staff, so a real cat lover to do our cat blood pressures. We try to minimise the amount of people within the room, so normally 2 people is more than sufficient. If the cat gets stressed at any point, then we would stop. We would let them have a wander around, give them a stroke, give them a love, and then we would continue when we felt appropriate. The actual blood pressure reading itself really only takes 2 to 3 minutes. In all reality, it's the acclimatisation and taking your time with the patient that takes the longest element. Generally, both vets and nurses take blood pressure here. We try to encourage staff, training staff, so student nurses, lay people, nursing assistants to start to learn to do blood pressures in anaesthetised animals. It's much easier to do. You can have someone help you because they're still. Once they feel confident, we'll move on to a calmer cat or a dog, and then eventually we will then try them with a slightly more stressed or difficult animal to handle. So it all takes time, but everybody is encouraged to participate in checking blood pressure measurements. I truly think that we all think it takes too long when we start to do something, but getting used to the process, training your staff, you will simply realise that it literally takes moments to do, and it provides you with an absolute wealth of information. Most hypertensive cats you won't recognise unless you check their blood pressure. So what I would suggest is get the whole team going. Really, if you're finding that your readings aren't accurate, check your cuff size. That tends to be the most common problem. Ask somebody that's slightly better than you to have a go and check the reading as well. And that really tends to iron out our problems in practice. I think that the majority of owners tend to actually be quite receptive to measuring blood pressure. Hypertension is a very common problem in human medicine. They can often recognise how dramatic some of the issues caused by hypertension can be, such as retinal damage. So generally they are very keen, and then we just incorporate as part of our old age animal health checks or chronic disease checks, then yeah, they are very receptive. I think probably 50 to 60% of the time they tend to see a positive response.